Stream. As coronavirus sweeps the nation, public transit systems across the country are adapting to extremely low ridership levels. Joining us now to discuss is Nolan Gray, senior contributor at Media Group Young Voices and research fellow at the Mercatus Center at George Mason University. Great to have you here with us today. Let's dive right in the interest of time. How has the coronavirus impacted public transit systems from what you've been studying, especially here in the U.S.?
Well, it's been slamming a lot of transit systems. Of course, most systems have seen a 70 to 90% drop in ridership. Of course, there's a lot of things going into that. For starters, about 20% unemployment is not helping. Many Americans aren't commuting at all. Those still lucky enough to have a job are, of course, staying at home. At the same time, you have headwinds with gas prices. So gas prices are at historic lows, at least within our lifetime. So many people who might have taken a bus or a train are now finding it affordable to take a personal vehicle. At the same time, too, most local governments and transit agencies are facing pretty serious fiscal crises. Of course, transit agencies because of the reduced ridership, and local governments because of reduced tax revenue. And so in many cases, these services are actually having to make pretty serious cuts.
New York City shut down its subway last week between the overnight hours of 1 and 5 a.m., offering bus service instead, and many other cities have implemented similar plans. How do public transportation shutdowns impact overall ridership, even post-pandemic?
Yeah, well, it's pretty incredible. I mean, New York City subway shut down for the first time in 115 years just recently. So it's been pretty dramatic. When you have 70 to 90% reductions in ridership, the natural reaction from a fiscal perspective, of course, is to cut service, consolidate lines, reduce headways. The trouble is, in many cases, what's good from a fiscal perspective is bad from an infection perspective. If you have one or two people per bus or per train car, this is actually good in the sense that they're not crowded. Of course, some of us have seen these pictures of the New York City subway completely overcrowded in recent weeks, and people are wondering what's going on. The answer is, from a fiscal perspective, they're having to reduce services. Many transit agencies have retooled to specifically accommodate essential workers. So lines to and from hospitals have received significant upgrades or faster service. And so this is positive, but for the most part, they've responded with pretty significant service cuts.
How can cities use shutdowns like this to improve the overall transportation infrastructure when there's less ridership?
Yeah, well, in many ways, it's the best time to be doing upgrades, to be doing necessary maintenance. Not only because there's not traffic. So if you're doing any kind of subway work that involves ripping up a street or building over a street or on a street, as is the case with many bus rapid transit systems or subways, this is the perfect time to be doing that work. In LA, of course, Wilshire Boulevard, they're building the new Purple Line, and they completely closed Wilshire Boulevard actually to accommodate this work, whereas normally this would cause pretty massive disruptions for most auto commuters. At the same time, too, many cities are going to need fiscal stimulus. So 20% unemployment, there's a lot of people out there who need work. And so this is really the ideal time to be making these upgrades. San Francisco, of course, has been doing a lot of major track maintenance recently. A lot of other cities have responded the same way.
So what do you think public transit will look like post-coronavirus, post-pandemic, as some of them have been hit hard and their financial positioning, especially coming out of this, may be in a very bleak position?
Yeah, that's exactly right. I think in the near future, you're going to see significantly lower ridership. People are scared, understandably so. We don't necessarily know that there's a relationship between transit and the spread of the virus, but of course, people are understandably extra cautious. I think the fundamentals are that people are going to continue moving to cities. America still has an incredible number of underserved cities, suburbs, and neighborhoods from a transit perspective. So that will return, and really the wise thing to be doing through this is to continue making upgrades and to continue improving systems. But for the near future, it will be crunch time for transit agencies.
Just briefly, while we have you, as we look to the future, some cities may and have already implemented micromobility devices such as e-bikes, e-scooters, electric pedal-assisted bicycles. Do you think this type of transportation will become the new norm?
I'm incredibly optimistic about micromobility. One of the big transit success stories really from the last 10 years has been the deployment of bike shares. So, of course, here in DC, Capital Bike Share has been a huge success. In New York City, of course, City Bike has been a huge success. You also have private dockless systems being deployed. So especially now when I go out, if I have to go out, where I normally might have taken a bus, I'm now hopping on an electric scooter or a bike share. So I think that there is incredible potential for these in the next few years. E-bikes have gone from being the cost of a cheap used car to increasingly under about $1,000. Same with e-scooters; these are going to be increasingly affordable. And in the near future, next 2 to 5 years, people are still going to be skittish about getting on shared transit. So I would be incredibly bullish about it. And cities should also be responding to that by, in the near future, expanding and improving bicycle infrastructure.
All right, Nolan Gray, who's a senior contributor at Young Voices and research fellow at the Mercatus Center at George Mason University. Thanks so much for taking the time.